Hello, CANdid Connection is Molly Maidenblick, your host with the American Cancer Society Cancer Action Network. I don't know about you, but I feel like it's been a while for me, even though it hasn't. We haven't taken a break, but I took some time off for Thanksgiving break, so I feel like that's put me in a nice, relaxed mood for the holidays. So I feel like it's like getting back into the swing of things here. So I appreciate everyone being with us here in November, and it is Lung Cancer Awareness Month. So I know we just got done with October and breast cancer awareness, and I know that's a big one that a lot of people know about. A lot of businesses participate in, having pink something to do with their business, but lung cancer is actually, I'm happy that November is bringing awareness to lung cancer and what an issue that this is, not just in the country, but here in the state of Michigan as well. So I'm very happy and excited for our guest today. We have Dr. Mamdani, so let's get her on the screen. Hello, she is with the Barbara Ann Karmanos Institute. Thank you so much for being with us today.
Thank you, Molly. Thanks for having me. I am very, very delighted to be here and share my thoughts and insights on lung cancer screening during this very important month of November.
Yes, well, we're so happy to have you and all your insights, your expertise. Could you give us a little bit of your background just so we get to know you a little bit better?
Absolutely. So I'm a thoracic medical oncologist and assistant professor of medicine and oncology at Karmanos Cancer Institute and Wayne State University. I also lead our thoracic oncology multidisciplinary team and lung cancer screening program at Karmanos. My area of expertise includes management of lung cancer, and I've led multiple clinical trials in lung cancer utilizing novel treatment agents.
Wonderful. Well, it sounds like we have the right person on our podcast for this month. So thank you again for joining us. Well, I'll just get right into kind of some of the questions that I think our viewers and our listeners would be interested in getting some answers to. So as I mentioned, like lung cancer is, I don't know, I think for me, it doesn't seem like it's as prevalent as some people think, but it is the leading cause of cancer death. It makes up almost 25% of all cancer deaths. And so I was wondering if you could talk just a little bit about what are some of the common lung cancer risk factors?
Absolutely. So, by far, cigarette smoking is the most common risk factor for lung cancer. It accounts for nearly 80 to 90% of lung cancer cases that are diagnosed annually. What generally happens is the chemicals within the cigarette smoke, called the carcinogens, that can lead to mutation or glitches within the DNA of the cancer cells. And those glitches ultimately lead to development of cells that do not have the stopgap mechanisms. So they sort of turn into these uncontrolled copying machine. These cells keep producing more and more abnormal cells, and that's what then leads to development of cancer. However, there are other risk factors, also other exposures that can lead to similar glitches in the lung cells and can lead to cancer. So some of these are exposure to radon, asbestos, secondhand smoking, of course, which oftentimes it goes unnoticed. And we also know occupational hazards such as, miners and firefighters are at a higher risk of developing lung cancer as well. And we have seen it among first responders to 9/11 event. So there are a lot of lung cancer risk factors, of course, cigarette smoking being the most common one, but we should absolutely not ignore less common risk factors.
Sure. Yeah, you always hear those stories, right, of, people who get lung cancer and are shocked because, they never smoked. So it's not just that, but I don't want to ignore, obviously, the issue that smoking is. And so to kind of talk a little bit about what ACS CAN, what we're working on, Michigan is one of the top 13 states in the country we have a really high smoking rate. And so we're really working on trying to bring that down because of obviously just the high cancer rates that we have across this country. And we're not going to be able to make a dent in that if we don't bring down the smoking rates. And so that's a huge, huge issue. I don't think a lot of people are aware of how high the smoking rate is in the state of Michigan. So it's not really a stat we should be happy about. So.
And prevention is better than cure. So smoking cessation is our key to decreasing the incidence of lung cancer and finally beating this disease.
Yeah, absolutely. So we talked a little bit, obviously, about the risk factors, but so I found this interesting that most people who are diagnosed with lung cancer are 65 or older. So very small number of people that are diagnosed are younger than 45 and with average age about 70. Hopefully I have all my statistics right here. So what age do you recommend that people start getting screened for lung cancer?
So the guidelines for lung cancer screening, current guidelines that we have, are based off of large randomized clinical trials
Okay.
that included people who were considered at a higher risk of developing lung cancer.
Mm-hmm.
And the high risk was defined by age and the number of cigarettes people smoke in a day, or in other terms, we call it pack years. So the number of packs that are smoked per day multiplied by the number of years the person is smoking, that basically leads us to a number called pack years.
Okay.
These trials did not include people who do not meet these traditional criteria. So we talked about those less common risk factors.
Mm-hmm.
These studies basically did not include people who were exposed to that, but did not meet the eligibility criteria for a specific number of pack years. So with that disclaimer, currently most of the healthcare societies recommend lung cancer screening between the ages of 50 and 80 years, and for people who have smoked at least 20 pack years of cigarettes, and those who are either currently smoking or have quit within the past 15 years. But, having said that, like I said, less common risk factors are not included in these clinical trials. And so we will just have to rely on these data until we get more data on the individualized approach.
Sure. So I was reading something about where people will go in and get screened for lung cancer, and thankfully they don't have it, but then they don't go back and get screened again. So how often should people get screened?
You actually brought up a great point, and I get asked about it all the time. Lung cancer screening by way of doing low dose CT scan of the chest should be done annually.
Okay.
And the reason for doing it annually, and the fact that we can't get away with just one scan, is that oftentimes the first scan is normal and abnormalities show up on serial imaging. The other reason also is that on first scan, we may see some findings that are not concerning at that point, but we have to follow them up over a period of time to make sure they are benign, or if they're turning into some form of a concerning finding, then we have to approach it differently. The other thing that I also wanted to bring up, oftentimes people don't want to get annual screening is because of the concerns about some of the harmful effects of screening imaging per se. One of the questions that I commonly get is there a radiation exposure risk with repeated CT scans? And answer is yes, there is exposure to radiation every time someone gets an X-ray or a CT scan, but the low dose CT scan that we use for lung cancer screening does not utilize IV contrast. It's done over a period of seconds or minutes, so it's a very short scan. And the radiation exposure as a result is much lower than a routine diagnostic CT scan. It is lower than the average background radiation exposure just by being on planet Earth.
Okay.
It's just slightly higher than the mammogram risk, but overall the risk is not substantial.
Sure. And obviously it's very important to get, the screening will help you catch it sooner. And obviously I think we all know that the sooner you catch cancer, and whatever cancer it is, the better shot that your doctors have and to fight the cancer. So
Absolutely. And the earlier detection of cancer at an earlier stage has the biggest advantage that it is curable at that stage,
Right.
not only treatable, but curable.
So I had a question that just came to my mind. So I'm kind of following it. So bear with me for a second here. So I'm just thinking of somebody who is, let's just say, I'll take me as an example. I am below 45 and I've never smoked. I was never around anybody who smoked. So the risk of secondhand smoke really isn't high with me. I'm at a young age. So I probably wouldn't really fit into this category of, probably being recommended I need to go get an annual screening for lung cancer. But let's say, what would I be looking for? What are some of the things that I would be feeling if maybe I have lung cancer, or, somebody who has a couple of the risk factors, right? Maybe 65 and has been a firefighter, but like they feel fine, nothing's going wrong. Are there any kind of symptoms, I guess, of like maybe I should go get a screening for lung cancer?
Mhm. So, the one of the challenges with lung cancer is that most of the times in earlier stages, it is asymptomatic. So it would not lead to any symptoms. And oftentimes, diagnosis is made sort of incidentally. So let's say a person goes to emergency room with shortness of breath. Shortness of breath may be because of something completely unrelated, but then they get a CT scan to look for a pulmonary embolism, for example,
Mm-hmm.
and it shows a lung nodule or a mass that would have otherwise gone unnoticed. Um, if the cancer involves, important areas of the chest, for example, if it's close to the ribs or close to the center of the chest, then it may cause cough or chest pain or shortness of breath, those kind of things. The key is that those symptoms tend to be persistent no matter what you do, and they
Okay.
generally get worse with time, even though you are doing symptomatic treatment. And in
Okay.
more advanced stages, people start to lose weight. They may
Mm-hmm.
have pain or symptoms from sites of metastasis if the cancer has metastasized. So there are a lot of different symptoms.
Mm-hmm.
But most importantly, we should be watching out for anything that's out of ordinary in terms of cough, chest pain, shortness of breath.
Okay. Okay. Yeah, and we're talking about this in the middle of flu season, so it's out of the ordinary, and yeah, it's not getting better, that kind of a thing.
Yes.
Not just as I'm trying to hold back a cough here, but so where let's talk a little bit about e-cigarettes and the risk for lung cancer, because unfortunately e-cigarettes are turning into be quite popular amongst our youth.
hmm That's a great and very timely question, Molly. So, with e cigarettes, the problem is that we do not have very compelling data with regards to the link between use of e cigarettes or the liquid within the e cigarettes and the risk of development of lung cancer. However, data are emerging. And in fact, recent presentations showed that people who used e-cigarettes had a higher risk of development of lung cancer and bladder cancer. These are two typically smoking associated cancers compared to people who never smoked. So there's definitely emerging data. We
Mm-hmm.
also know from biochemical studies that the vapor from the e-cigarette does contain carcinogens. These are the same
Oh.
chemicals we talked about that lead to mutations or glitches within the DNA of the lung
Mm-hmm.
cells. So there is every reason for concern for the carcinogenic impact of e-cigarettes. The problem is that most of the people who use e-cigarettes are younger people, as you pointed out, and there's usually a lag time of about 10 to 15 or sometimes even 20 years, between the
Sure.
exposure to these carcinogens and actual development of cancer. So as we go along, as we move forward in time, and we see that more population is exposed to the e-cigarettes, there will be more data that will come out. But there is absolutely every reason for concern.
And so unfortunately, it sounds like we're going to be having a lot of data, and we don't. It's I don't know. It's discouraging to hear some of the marketing of oh, it's just water vapor, or these aren't as harmful, or however they want to market this. But we know that it's not safe, and unfortunately, just because we don't have the data doesn't we don't want to wait 10, 15, 20 years to find all of these people who have developed lung cancer or any other kind of cancer from e-cigarettes. So it's
Absolutely. Absolutely. And so, in general, also anything that is smoked, anything foreign that goes in the lungs is likely to cause damage. Now, it may or may not lead to lung cancer development, but it is definitely going to lead to chronic lung disease. So there is also a concern about an increase in prevalence of chronic lung disease among people who have used e-cigarettes for many years.
yeah. Your lungs definitely don't like it when things go into it that aren't supposed to go into it, right? Have you ever inhaled your food? So I don't like that. So now that's going to cause cancer. But, okay, so can you tell us a little bit, our viewers, if they're feel like maybe they hit some of these risk factors or are maybe of the age, where can they go to find out more about lung cancer screening? Like where they, how they could get that, who they should talk to about that?
Absolutely. So we offer a comprehensive lung cancer screening program at Karmanos Cancer Institute. So our website has all the information about lung cancer screening, including the eligibility criteria, risk factors, how to go about getting into the screening program. I always encourage people to talk to their primary care providers or pulmonologists for referring them to lung cancer screening programs. Other websites such as cancer.org or US Preventive Services Task Force.org. Those are really good sources for further information about lung cancer screening. I also wanted to point out one thing that it is better to get the lung cancer screening through a program because it basically consists of multiple people with expertise and experience in managing or following up on the abnormalities that are detected on the scan. We also need to remember that lung nodules or cancer is not the only thing that is detected on lung cancer screening scan because the scan is for the whole chest. So sometimes it detects unsuspected findings, so such as aortic aneurysm or abnormalities with coronary arteries, those kind of things. And so being a part of the system where there is a process in place for these kind of follow-ups is absolutely necessary.
Yeah, that's a really good point. One that I certainly wouldn't have thought of. So thank you for bringing that up. So I think those are all the official questions I had for you. Is there any other kind of final message or any other thoughts that you wanted to leave our viewers with today?
Yes. So, we talked about these risk factors for lung cancer. We also talked about how lung cancer carries high mortality. And just to kind of, put numbers into perspective, each year more people die of lung cancer than of breast, prostate, and colon cancer put together. So why is that? It is the second most commonly diagnosed cancer, but definitely the leading cause of mortality. There are two reasons for that. And first and foremost, of course, is that majority of people are diagnosed when they already have advanced incurable disease, because as I said, most of the times early stage cancers are not symptomatic. Only about 18% of people are diagnosed with an early stage cancer when it's still curable. And that's why we have these screening guidelines in place. But unfortunately, the uptake of screening for lung cancer is rather slow. If we compare it with the uptake of mammograms and colonoscopies, pap smears, lung cancer screening is far behind. There are multiple reasons for that, lack of awareness, lack of access to healthcare, lack of access to screening facilities. Sometimes, this can be associated with social stigma or guilt because of its strong association with smoking. So we definitely need to do a lot more to overcome these obstacles and improve our screening rates. And then the other thing is that oftentimes, even when the cancer is diagnosed at an early stage, it is still not easy to treat because lung cancer does have a lot of mutations, a lot of glitches in the DNA, which makes it very aggressive. And so, to ensure that not a single life is lost from lung cancer, we need to spread awareness and support research and help our community get the screening. So that would be my ultimate message for the viewers today.
Well, a wonderful message to leave us with. And you put it much more elegantly than me, because what I was kind of starting with this of when we talk about, October being Breast Cancer Awareness Month, I don't think people know that following it is November is Lung Cancer Awareness. And what you're saying is lung cancer is so much more prevalent than, what were the three cancers combined that it's breast, prostate, and cervical cancer? And colon. Okay. There's lung cancer is more prevalent than all of those combined. And it's really, really important to get screened and to know that lung cancer is still a problem, and that a big part of dropping these rates would be to bring down the smoking rate. And this is, something I said earlier, ACS CAN is we're really working to do that, to try and help those people who are looking to quit or to stop people from starting. So I really can't thank you enough. And I really appreciate all your time. I think this was a wonderful conversation. I hope you enjoyed it as well.
I absolutely enjoyed every minute of it. And thank you so
Wonderful.
much for having me. I really appreciate this opportunity.
Of course. Well, thank you. Hopefully we can connect again in the future. I know Carmanos is a great partner with ACS CAN, and we certainly enjoy the partnership. So thank you so much.
Of course. Thank you.